If there's anything that the COVID-19 pandemic has reminded us of, it's just how connected we all are to one another. And when it comes to beating a pandemic, it's all hands on deck. We know that an informed public plays a really important role in preventing the spread of COVID. And to effectively mitigate this spread, everyone must participate in preventative efforts. However, certain communities are often missed in these efforts due to communication or cultural barriers. The Hmong community in north central Wisconsin has not been consistently reached through public health communication in the past. And when the pandemic hit, the lack of communication with the Hmong community became more apparent and necessary than ever before.
The H2N project came about as a response to the COVID-19 pandemic. It was like a call for us to better communicate with one another, pretty much.
And so we built a bridge between the Hmong community and county health and resource organizations. We designed a bi-directional communication model that designated respected and connected Hmong community coordinators, each of whom managed a network of health workers. The Hmong health workers served as liaisons, met with community members, assisting in COVID education and preventative strategies, and helping with information such as where to be tested or what to do if symptoms arise. And they were chosen because they were already integrated into local organizations that were frequently used by community members. This way, they were already trusted and accessible local leaders.
Nyojong or hello. My name is Pong Va. I am one of the Hmong liaison here in Portage County. I see that H2N is needed in our community due to many obstacles that our people are facing today. I think the two biggest obstacles is language barrier and health care access.
The health workers also played an integral role in gaining insight into the impacts that COVID has had. Liaisons did this by collecting survey data during their outreach, looking at current beliefs and fears surrounding COVID and the challenges and hardships that COVID has brought on. We found that there was a ton of fear and worry that existed around COVID. We found that social and economic impacts from COVID have been drastic. Social gatherings, especially with extended family, are central to Hmong culture, so many survey respondents commented on how difficult this time has been. We saw many responses highlighting need for resources like food and rent assistance. Many also mentioned the language barrier to navigating the constantly changing information about COVID.
Our goal is to communicate and outreach to our community in regards to public health issues, access, and resources while working with partners, local partners, to close these gaps.
What I see is that the H2N project has become a trusted source because we work and boots on the ground sort of like model with their communities, and we are right there with their communities collecting information, hearing their concerns, and once again relaying it to our organizations.
And because these needs were able to be voiced, listened to, and then shared through this newly established model, we were able to respond with action.
There are interpreters available. There's also transportation available, but it's just, do they know these resources?
In response to the financial need that was identified, our community liaisons worked on helping people apply for financial assistance programs. Food boxes and food vouchers were distributed weekly to families at resource centers like the Hmong American Center, and also helped community members find testing sites and navigate health clinics when needed. We also started a free community vaccine program that was launched with the goal of providing accessible vaccines at already utilized resource centers. We started the vaccine clinic with influenza vaccinations, as COVID vaccines were not yet available. And as our project moves forward, we plan to continue the vaccine clinic, providing flu and COVID vaccines as they're available. We plan to continue the educational efforts surrounding the pandemic, the COVID vaccine, and healthcare access. And now that we've established this communication bridge and identified health needs, we hope to continue investing in projects that address healthcare access within the Hmong community.
COVID-19 pandemic has been very traumatic and life-changing, but at the same time, it opened doors for all of us to start communicating with one another.
COVID was definitely this kind of a call to action, like all hands on deck. We need to be a team through this. There's no other way.
Once the pandemic is over, my hope is that we continue to help the community with accessing and understanding the healthcare system and Western medicine, and also be a trusted place where our community can come to us to get the resource and information that they need.
It's wonderful to see that WASA has so many people who care about people here.
We envision this form of communication that focuses on intentional listening to Hmong community members, extending long-term beyond the COVID-19 pandemic.
Thank you.